Hello everybody, my name is Trevor Hall. I'm a student at Concord Career Colleges and I'm in the Physical Therapy Assistant program. And for my presentation, I decided to do it on knee injuries. I figured that this would be appropriate seeing as how myself am going to be dealing with a lot of patients with knee injuries that need rehab. So I actually have a little bit of experience of my own. I had a knee injury a couple years back, so I'll talk about that in a few minutes. But what I'm going to go over today is the makeup of the knee, what bones come together to form the knee, the ligaments of the knee that support those bones, and if one does occur a knee injury, kind of the steps that will be taken after that as far as going to the doctor and what they'll do, if they're going to take x-rays or MRIs, things like that. And then if they deem that a surgery is necessary, what the steps will be from there on. And then post-surgery through the rehab, what the process is like and what the goals are for that. So that's kind of the overall summation of what I'll be discussing today. So without further ado, the bones that make up the knee, there's the patella, the femur, and the tibia. They all come together to actually form the knee. I have a picture right here. If you can see the patella, the femur, and the tibia. So they all come together right here to form the knee. With those bones, they need support. That's where our ligaments come in handy. The ligaments that make up the knee are the ACL, the anterior cruciate ligament, the PCL, the posterior cruciate ligament, the LCL, the lateral collateral ligament, and the MCL, the medial collateral ligament. With those four ligaments, that's what gives us stability when we're, going throughout our daily lives, walking, stepping up and down off curves, playing sports, running, sprinting, cutting, all sorts of things. We need a lot of stability in there. Our knees get used every day. So because they're under so much use, there's more opportunity for them to get injured. For me, I tore my ACL back 4 years ago, and along with the ACL was the meniscus, and I did a small little tear on the MCL. But I completely severed the ACL, and what I did was, that's actually a grade 3 sprain on my ACL. There's grades 1, 2, and 3. If you just have a grade 1, it's a mild stretch of a ligament, and most of the time surgery is not needed for something of that sort of injury. It's too mild. And then grade 2 is a partial tear of the ligament, and grade 3 is what I had done to my ACL, and that's the complete severing of the ligament. So when somebody has an injury, when somebody goes and they hurt their knee playing a sport, playing football, whatever it was, I actually tore mine playing ultimate frisbee with some guys from work in the military, and I jumped up to catch frisbee, came down on my right leg, all of the weight on my right leg, and I felt a pop, and I could actually feel the bones shift back and forth. It was very painful, and I couldn't move it at all. I was laying on the ground. I had never had a knee injury before. I didn't know what to expect. I didn't know what I did. Turns out, like I said, I completely tore the ACL. So sometimes you'll see people tear it, and they'll get back up, and they'll keep playing or keep walking around. Like I said, I tore my meniscus and the MCL as well, so I had done quite a bit of damage in there. And for me, I went in and saw the doctors the same day because, like I said, it was hard for me to walk. I couldn't put any kind of weight on there. So if you feel that you have maybe torn a ligament in your knee and you need to see medical attention, chances are they're going to take an x-ray of your leg. That's what they did with me, and make sure that there was no bones breaking, anything like that. And after that, they wait for the swelling to go down. You're going to have a lot of inflammation in there after an injury. So they'll wait for the swelling to go down, and after that they'll take an MRI to really get a good look at what happened when that injury took place. So if they deem that it is necessary for surgery, they may wait a couple weeks for the swelling to go down before they cut open the knee and perform the operation. That's what they did with me. They waited about a month. The surgery, it didn't take too long. I went in, I was out the same day, and I started, actually I have a visual aid right here. If you can see, this is the scar from the surgery with the ACL. They actually took the patellar tendon and used it for the ACL. They can do that. They can use it. You can take a graft off a body, a dead body. There's other areas where they can take tendons, ligaments, and put it where your ACL was. So that's what they did with me. After the surgery, it was maybe about 2 weeks or so before I started physical therapy. And in the beginning, depending on the degree of injury you had and if you had surgery or not, they're primarily just going to focus on getting the circulation back to that area. Since you've most likely been stagnant and you haven't been moving around, your knee needs that circulation. So they used electrical stimulation on me. They did ultrasound with my knee just to promote the blood flow and the oxygen to that area. And after that, worked on range of motion. I did quite a bit of stretching, trying to get that back. Everything was very tight in my leg after the operation. So that was the next phase of physical therapy for me. And after that, when you're able to walk and you have some flexibility back, you start to actually strengthen that leg again that was injured. So they'll run you through a gamut of different exercises that can be done basically to strengthen those muscles that haven't been used in a while and to work on your stability. You won't want anything else to happen after going through everything you went through to get to where you were. So generally, depending on how bad that knee was injured for physical therapy, and maybe an individual in their 20s is going to heal a little bit quicker than somebody in their 80s, and so they'll be done with physical therapy quicker. But maybe 4 months that they'll be doing physical therapy, give or take, and about a year, you can really feel like you're progressed quite a bit. That's where I was, at least. So that's kind of the process of injuring your knee and going through the operation and the rehab for the physical therapy. The resources that I used to create this presentation were moveforwardpt.com. They had a lot of good information on there in regards to the process of physical therapy with the knee, and also the healthharvard.edu. They had some really good articles about how incorporating physical therapy after a knee injury was really beneficial to a lot of people. They did quite a few studies. So that's the information that I used. Anybody have questions? watching.